everyone. Hope you're all doing good. Guys, we are meeting up once again for the OMR series just to make your OSCE experience wonderful and to help you to approach these cases. So today we are going to deal with an antenatal care module. Once again, a patient simulated task, which could be very helpful during your exams. Yes, as it always, the saying goes, if your dreams don't scare you, they are too small. Right? So it's if you are scared of the exams or if you're scared of your dreams, then you are on the right path. So what we are going to do today is a patient simulated task. Yes, I have Dr. Priya, who will be our examiner, and Meera, who will be my role player. So I'll show you the task and then start the 10 minutes. Of course, we are going to mimic just like the exam. So role player has got a script and I'll be the candidate. And once the 10 minutes is finished, so we are going to get the feedback from the role player and as well from the examiner. And towards the end of it, I'm going to actually tell about which is the better way to go ahead. Okay. Hi, Meera. Hi, Priya. So,
hello.
Yes, let's start. So this is the task. Of course, I'll start at the time because that's how the exam goes. Okay. Anna Franklin?
Yes, ma'am. Hi,
Hi. Anna, is it okay if I call you Anna?
Yeah, ma'am.
Yes. Yes, Anna, this is Dr. Sowmya here. I'm one of the registrars in the clinic today, and I'm extremely sorry. The consultant was supposed to meet you, but because of his busy schedule, he has actually asked me to meet you. Hope that's okay.
Yeah, that's okay.
Yes. Anna, I'm aware that you had gone for a needle test and you are here to discuss the same. Am I right?
Yes, I have done like a few days back, my 18th week.
Okay. Anna, is it okay if I ask you a few questions before I reveal the report, or do you want to know the reports first?
I want to know the report first.
Okay, sure, Anna. Anna, before I tell you the report, is there anybody with you whom who can support you during this explanation of the report?
I have my husband with me here.
Okay, so do you need any additional support? Can I ask my nurse Sarah also to be with you if you wish?
No,
okay.
I'm fine, doctor. I would like to know the reports.
Okay, Anna, I'm sorry, I'm afraid the report is not as expected. Okay, so when we send for the needle test, this shows that baby has got a serious genetic life-limiting condition, which we call Edwards. I'm really sorry, this is not the report you expected. I'm really sorry, Anna. Do you need some water? I'm really sorry. Do you, should I book another appointment? Or should I explain you further?
That may be okay, doctor.
Yeah. Anna, just to tell you a few things, okay? So as I mentioned, this is a life-limiting condition, which we have actually cross-checked twice, okay? So before I explain what that mean to you, can I ask you a few quick questions?
Please.
Yeah. I know that this is your first pregnancy and you're into your 18 weeks. And whom do you live with?
I stay with my husband.
How is the support at home?
Yeah, they're all good. They're all supportive.
Okay. Do you have any allergies at all?
Nothing so far, no.
Okay. And any such history in the families so far which has happened like this?
Nothing in my awareness.
Okay, Anna, thank you for that quick details. Anna, actually, what does this mean is basically, as you're aware, when we did the scan, we knew that there were some problems which we were expecting, as you're aware, but we did the needle test to confirm the genetic makeup of the baby. For all the healthy babies, we get 2 sets of chromosomes from each pair. There will be only 2 pairs. But what happens is in trisomy 18, that is the Edwards syndrome, at number 18, there is 1 extra copy of chromosomes. These chromosomes are the genetic codes which decide which cell becomes what. Okay. Are they clear so far, Anna?
Yeah.
Okay, this extra copy of genetic codes has causes the problems to the baby. And because it's at number 18, it could mean that baby can have serious problems with the heart, brain, and as well as its development. So what we have seen is mostly half of the babies, I'm really sorry to say this, half of the babies tend to have or tend to die inside the womb. I'm really sorry. And some of them can have a miscarriage. Okay. Okay. And rest of the babies, once again, they can live maximum up to a year or so.
Is there any wrong? What happened? Like, why did that happen? Something that, did I do something wrong? Did I take proper care, or is there something?
And Anna, I can see that you're really upset, but don't blame yourself. There is nothing which you could have done for this, because this problem happens when the baby has been forming inside the womb. This is a genetic problem.
Why? Like, nobody has any issues like this, you know? My siblings or my husband's family, no one. I'm just hearing this for the first time, you know. Why
Yes.
this is happening to us? Why us?
Yes, Anna. The thing is, this we cannot exactly say why this has happened, because you do not have any risk factors in your pregnancy which we can point out at. Okay, so this is something which could happen for many women without any reason. Okay, however, I want to say you the options in front of you. Some women in your place would want to end the pregnancy, and some women would want to continue the pregnancy. I would like to know your thoughts on this.
I don't want my baby to, I don't want to end my pregnancy. I want my baby. I
And
have hopes my baby can come out safely, right, doctor?
Anna, I respect your decision of continuing the pregnancy, but I can, as I mentioned to you, I'm going to take you through what can happen during your pregnancies for you and for the baby. So it will help you to take an informed decision. Okay, so during the pregnancy, what happens? You would be taken care by a group of specialist doctors, including my consultant baby doctor and a physiotherapist as well as a genetic counselor would be part of our team as well. We would be doing additional visits just like any other pregnant woman, what we do. Plus, we would be monitoring the baby's growth, because we know that babies tend to grow small when compared to the other babies. Every 2 to 3 weeks, you will have a scan of that. And at every visit, you will be assessed for risk for you if you have any risk of having clots, which is a general checkup which we do. And for the baby, there is always a possibility that you can tend to deliver earlier than the normal time. So if that happens, we would be talking to you to provide you the injections which are called steroids to help to protect the baby to a certain extent.
Will my baby be in trouble? Like, is he going to be in some pain, or is he suffering something?
Okay.
I mean,
I can see that you're really worried about too many things, but I just want to reassure you that you're in the best of the hands. We would make sure that the best care baby would be getting, okay? And during the delivery also, we will offer you normal delivery unless there are problems, because what happens sometimes the fluid around the baby can increase. So that can cause you probably deliver earlier, probably that can put you at risk of having breathing problems. As and when we move, we will be going to tell you that. If there are any such problems only, you will be delivering through cesarean. Otherwise, it will be a normal delivery. We will be telling you at that point of time. Okay. And once the baby delivers, we are really not sure how long the baby is going to be. And whatever the best care we would provide, we will be providing the baby. And meanwhile, the baby's doctor would discuss with you whether you would want to give a comfort care where we will just protect the baby to be in comfort, or whether we would be giving an active care based on your things at that point of time. Okay.
but kids are surviving, right? We can expect at least 1% of survival, right, ma'am?
But in this case, what we have seen, most of the majority of the babies like die within 1 year. Max to max 1 year is the survival time which we are looking at. But as promised, we would make sure that you would be getting all the support what we can offer for you. Okay.
So my baby will be in monitoring, like
yes,
in an ICU or something like that.
Yes, once a baby is born, based on the condition, definitely, whatever the time the baby will be here would be he or she would be needing intensive care from our team, which we will be detailing you as well in the coming visits. Okay. And just to tell you, like there is a lot of support groups which we would be offering you. Okay. So that you can speak to the women who have walked the same path. Okay. And second thing, I know this is too early, but just to give an information for your next pregnancies, we need to make sure that the genetic counselor talks to you and look into the what additional tests we can do to make sure that the next babies are safe as well. Okay. And anything else which I can help you with, or anything which I haven't covered so far?
It's clear, ma'am. I have understood, but I'm just concerned about my baby. Any survival option or anything that you can do, please support, because I want my child.
Definitely, Anna. I can see your hope and expectations, as I mentioned, because we are sure of the baby having this. This is the maximum survival we got. However, I'll be putting you in touch with the consultant and baby doctor to have a detailed discussion of what you expect, what you can expect, and what's the support you'll be getting. And definitely, I shall provide you the information leaflets and send you to GP as well, so that we are all on the same page. Okay. Thank you. Fantastic. Time. I finished on time. I hope so. Yes, Meera.
Thank you, ma'am.
Yeah, I didn't expect you to cry so much, by the way. How did you feel as a patient? Because that's important for the exam. Yeah. You're muted, Meera.
It's a very tough situation, ma'am. Being a mother, seeing her child where the survival is literally zero. You did comfort me. You were explaining everything in detail, and you actually said what's going to happen in a very subtle manner, which is a big support for a patient. I think it did give a great relief. And you are not saying that, okay, you're going to provide all the support that is required, and you're going to give all the care that I can get. So, yeah.
Thank you. Thank you. Yes, Priya.
Yes, so Dr. Sowmya, you did well. Okay, I liked how you presented. So from the starting, you apologized that the consultant was not available, and also this is a station of breaking bad news. So you gave the warning shot, and not like abruptly talking about the breaking bad news. So you gave the warning shot. You were empathetic. You told her to call someone or nurse, and then your tone was soft. You gave her tissues and the water, so that was really like empathetic. So and also you took pauses also in between, and whenever you were explaining the patient in the lay language, that was good. You avoided medical jargons, so that was really good. And you were checking that she was understanding in between. So and what were her concerns, so and what does she want, so that was like you didn't like impose any decisions on her, so that was good. And you explained her, so what can be the risk in continuing the pregnancy, and how she will be monitored, how's the baby's all the MDT that you explained, so that was really good. Yeah, and you also offered the PIL, so overall it was good, Dr. Sowmya.
Yeah, thank you.
And
Actually,
history,
yeah.
history, it was very crisp, that I liked, especially like to the point, because this is an anomaly station. So any family history of genetic problems, or any history if she has, or allergies, especially as a safety point, that was also covered. So yes, history that was asked, so that was really good. Yes, and
Thank
even the
you.
care also, I would like to tell she did really good.
Yeah,
Thank
so
you.
she was continuously crying. I was worried at some point, my God, what would I do? Anyways, thank you, Priya. But my only point was, probably only thing which I felt was I didn't go with the flow generally what people do, history of presenting complaint, medical, surgical, because I know there won't be time. Understanding the role play, she's going to cry more. And I
Yes,
know that timer will be going.
yes,
Probably I could have asked about her, whether she's generally fit and fine. That was the one thing which I thought I should have asked. Rest of the things, I think it was absolutely fine. And
yes,
ideally, termination of pregnancies, because she
yeah.
said I didn't go to that
Yeah,
extent.
that's what I felt. If the other option, even if the patient wants to continue, just to give the other option that it is not legal till 12 weeks, but in this case, maybe with the two consultants or.
Yeah, but the problem was she was so reluctant to talk about it.
Yes.
So that's why I didn't go to that point. Probably if she had said I had to think, I would have thought of. So I think probably those are the things which I felt. Thank you, Priya. Thank you so much. I know you're in the clinic. You can take a leave. I'll just brief them what it is. Thank you, darling. Thank you so much.
Yeah.
Yes, guys, just to tell you, so this is a case which can actually take away a lot of your things, because the role play can keep on crying, or they could be angry, telling that this is not the correct report or whatever. Basically, I have put it across the slides, which are, you need to remember two things. First thing is to ask in the beginning itself whether they want to break the news or to take the history. That's the first thing. If they say, please break the news then. Don't drag on, because it is in our clinical practice, we do that. And history taking, I was too crisp, because understanding the patient would cry. But if you think the patient could be more, you could ask about medical history. That's what I thought. Rest of the things, I don't think it mattered to me in any way. And yes, preterm labors, steroids, I just carried away, because I know that steroids are not required, but at the same time, I know it is lethal, but unlike anencephaly, where 100% babies going to die immediately, is not the case. Their babies could survive for up to 1 year. So that's the reason I carried off that. And I went very subtle about vaginal delivery and the cesarean section, which should be told about what they do. And intrapartum, yes, patient preference. If I had a time, I would have told her that the baby would be kept with you and all that. See, because that is something which in the real scenario, we say that how the complete intrapartum care and after delivery, what they can expect. So I just brushed around those points because I didn't want to mess them. Postpartum care, I agree. I didn't speak about the contraception and breastfeeding because I thought this was not the right thing to speak about. Because once we don't know what the babies will have a lot of feeding problems, developmental delay. So I didn't want to put it at that point of time, even though I remembered. Contraception, yes, it should be brought in somehow. I said for the next babies, but I didn't actually, because of the patient thing, I didn't say that, okay, you have to space your pregnancies, which is very rude in the station. And termination of pregnancy, just to tell you guys, please remember, less than 12 weeks is legal. More than 12 weeks, you need to take two consultants' opinion and then go ahead based on the whether it is lethal or non-lethal. Right. And counseling points, I think I have told most of them, respecting the family wishes. And these are the things with the words which you can use. I really felt I was a little clumsy when I explained the chromosomes, because I wanted to, generally I do draw a diagram, which was missing here. Generally, during my consultations, I write down telling that these 23 pairs, out of which 22 and all that, I write it very crisply. So probably that's the reason I felt I was a little clumsy there, which you can avoid. You can just mention that there are 2 copies for each chromosomes. At number 18, we have 23 pairs. At 18, you have 2 copies generally, but here there is a 3rd copy. So you could keep it simplified, but as long as the patient understands, that's fine. And I think to summarize, these are all mark-based. Summarize, history taking, yes, ask open-ended questions. I should have asked what I thought. If you asked me to improvise, can you tell me more about your pregnancy, is what I didn't ask her, because I know she would keep on crying. I already have an information, so I went ahead. Of course, I didn't ask the blood group. I remembered I didn't ask because already amniocentesis is done. If at all, if there was anything, they would have taken care. I remembered the blood grouping I was supposed to ask. Because of shortage, I skipped, but if you can, please include that. Communication, breaking bad news is extremely important. Check the understanding. Make sure the patient is with you. Let her cry. Wait till she finishes crying. Don't interrupt her. That's very important. Explanation of the condition. Management, don't jump to termination of pregnancy. Not necessarily that everybody wants to terminate the pregnancy. And psychological support. You could actually include one more thing, which I could have included the partner as well in the support, probably, which I only told her she can meet the woman. Probably the family support is something which I missed on. I think otherwise, time management, you should be doing, because patients can keep on talking, but you have to bring them to your things. Decision making completely based on that. But don't forget, nobody will say that consultant is busy, that's why you have to do. You have to realize that this is not something which you at your level you'll be dealing with. This has to be dealt by consultant. So yes, guys, hopefully that helps you to do this task, whether it is structured discussion or the patient similarity task. Know this in structured discussion, you'll be more prone to ask for the legal and the ethical implications of the terminations of the pregnancy. Thank you, guys. Thank you, Priya. Thank you, Meera. Thank you, guys. Thank you for joining for today's session. And yes, guys, for all of you, please subscribe the channel and get these OMR series. By chance, if you get this task, you know what to do about it. All the best, and thank you so much, guys. Thank you, everyone. Thank you.